people want to know how safe cosmetic surgery, how safe is it really, right? Because it's cosmetic, but it's also surgery. And surgery is surgery. It's something that the human body sometimes needs to have happen, but in our case, we're doing it electively, right? And so the surgery that happens in hospitals is generally for really bad problems, and those people are often very sick, and it's the sickness many times that increases the fatality or mortality rates that are associated with particular surgeries. For example, I've seen statistics where, and I'm an old general surgeon, I used to do these surgeries. If you need an esophagectomy, for example, having your esophagus removed, there's a 1 in 5, 1 in 6 chance it's going to be a bad problem. But those people are very sick. It's usually for cancer. It's a bad thing. And this isn't that. This is surgery that we do electively on healthy people. So even there, because it's surgery, we know that there are dangers that can happen, and we know what the numbers, statistics show. The most risky surgery that we do, I think, is probably a combination of a tummy tuck with liposuction. Statistically, here at Austin-Weston, we're well below what the national average for that mortality would be. We haven't had it. So it's really hard to say what our numbers would be. But statistically, there's a 1 in 3 to 5,000 chance that you could have a problem with that. And it's a combination of the anesthesia, but it's also the liposuction and the abdominoplasty. The thing that gets you in trouble with all of these surgeries is blood clots, right? The clotting of the blood, not only during the surgery, but immediately afterwards, is a problem. And when you bind an abdomen after a tummy tuck or liposuction, that compresses the blood return from the lower extremities. And so you've got to be very careful in that instance. First, not to bind too tightly. And second, to increase and stimulate the amount of blood coming back from the lower extremities. We do this a couple of different ways. One, during surgery, we always take precautions to put compression devices intermittently compressing the lower extremities. That kind of stimulates blood flow. When people wake up, so we also, during surgery, run people relatively lightly, so they wake up kind of awake but not in pain. While they're awake, and this is very important, they can move their extremities, sort of like moving their feet up and down, like pressing on the gas. And by doing that, you compress your calf muscles, moving the blood back up to the heart. It's very important. The other thing to do is to take deep breaths in, to suck in. And when you do that, your lungs expand. That relative vacuum draws the blood back up to the heart and helps it circulate. Those two things are very important, and we stress it to patients afterwards. On particularly risky surgeries for blood clots, we give people Lovenox after surgery, which helps them keep the blood a little bit looser so they don't form clots. And since we've been using that, we haven't had any blood clots after the riskier surgeries like tummy tuck and liposuction. None. And I think that combination is really, really important. The anesthesia component is also very important. The fact that we run people relatively lightly allows them to wake up quickly and, as I say, be alert to the problems that we want them to sort of skirt around. We have really experienced providers of anesthesia here that we work with on a daily basis with these common surgeries, and so we've really gotten used to them, and you can't underestimate the importance of doing surgeries frequently. You learn the problems, you learn how to get around them, and look, nobody takes this more seriously than we do. It would be just horrendous to have a problem like this occur, and we do everything that we possibly can, continually monitoring what we do, continually going to meetings, continually going out and trying to not only learn what the best and the brightest are thinking about out there regarding mortality, but also contributing what we've learned into the mix and into the discussion. And that's been very, very important. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.